Jessica has embarked on her own little journey to help herself, her hip pain and her back pain, and help others as well. And so she's been using Shockwave for the last how long?
I think we've had Shockwave for 4 months.
And so it started out. So chiropractic is really good at restoring range of motion, and it's really good at headaches and musculoskeletal pain, but it's really good at posture and alignment. Shockwave really adds a facet for soft tissue.
For chronic issues. So this Shockwave is not shocking you. It actually uses sound waves, and it uses that to penetrate and break up scar tissue, adhesions, calcification, deposits. It is really wonderful for chronic issues. You can use it with acute issues, but it really shines with the chronic issues that everybody tells you that you can't do anything else for it.
Well, let's just put it into perspective. As a chiropractor, I've done this for 30 years, and I have some people that we see weekly, and you want to help these people. And we haven't been able to with muscle stem and decompression and acupuncture and everything that I do. There just have been things that we haven't been able to do. And I have sent them to her for shockwave and actually talk about the things that you've treated and tell them, what the results have been. Because I think the most miraculous one is we had a gentleman that had broken his back, and we got him adjusted, and he started to feel better, but there was just always some pain, and he was in a brace. And what'd you do?
Well, we've had so many. I honestly, I haven't had really one person that didn't feel better. Now, it is not a one treatment and you're done. It's usually a set of treatments, anywhere from 3 to 10. I usually see a big difference in people between 3 and 5. So I always tell everybody it could probably take up to 6. I've never really had to do anything greater than 6 because usually they feel so good. They kind of leave me around 3 visits. So, first of all, if the machines are pricey,
Oh, yeah.
and he had shoulder pain. So he was my first subject. He had shoulder pain and had lost some range of motion, and when he slept on his side, it hurt. So we worked on his shoulders 3 times, and he's been pretty good ever since. I haven't heard him complain. I've also worked on his feet.
I was gonna say the the shoulder was awesome. The feet were amazing.
And I think I only did his feet twice. So my second guinea pig was our staff. Um, I've done their feet,
TFL pain.
their IT band, which she was suffering and could not sleep. She couldn't get comfortable. She we took her on a trip, and she suffered after a block of walking. And so when we got back to the clinic, I did her IT band, and she has been awesome ever since. No issues with sleeping. So getting back to the gentleman with the broken back, it was in his thoracic area, which you're kind of pushing it up in that area, but he could not get any relief. And I did his back 3 times. And each time I did it, he got better and better. But it was the first time that he could sit and stand without pain.
And
And I loved it.
he had a full brace. It went from it settled on his hips, and it went up to here, and he's out of it now.
Yeah.
And I would attribute that not to chiropractic, purely to the shockwave.
And then
Our attention hound
our
is
little dog is, or she's not
little.
little, but she's needing some attention. Anyway, I've done lots of shoulders. My
Go over the
my
symptoms.
patient he was, I want to tell him, my 87-year-old patient comes in because he is living his best life.
Hunter.
Absolutely. A hunter. He's a farmer, and he was dragging a deer out of the woods, and then his shoulder acted up, which it's been chronic for 30 plus years, he said. And he came in and he was suffering. And so I listened and I'm like, hey, maybe we can help. So I did it the first time. He felt so great. He went out on Thanksgiving. He went hunting again and pulled another deer in. And then he came back the second time and said, let's try that some more. And he came in last week, the end of the week, I believe, and was like, hey, I'm doing fabulous. I haven't felt this good in forever.
I'm going to tell a story on him. We can't say his name for legal reasons, but this is a gentleman that doesn't spend money on anything. You can't, he'll come in for his maintenance adjustment and that's it. He willingly came back and paid out of pocket. It was
So I've done lots of shoulders. They usually are great about visit 3, and then they come back if they are going to need me. I've done lots of back with radiating pain into the buttocks. It usually
Earphones.
relieves 70 to 75% of their pain as soon as they get up off the table. I do lots of knees, feet. Feet are fabulous. Probably 3 visits, 2 to 3 visits, and most people, they are feeling fine. Everybody has so much problem with their feet, but we had a gentleman that he's been coming in for chiropractic for years and has suffered with foot pain, neuropathy like pain, for a very long time. So he's done supplements, he's changed his diet, he takes his omega-3s, and we started doing his feet, and he started getting relief for the first time. So
and
I
that
love
gentleman is on his feet.
all the time.
He does beverages, so he's always pushing and pulling.
A lot of weight.
Yep, and it's the first time he has been smiling, been joking. It literally is life changing. And I'm not actually taking away from chiropractic. Chiropractic helps tons of people. You know, we see 40 people a day ish, and they all do wonderful. This is that segment of people, like she says, with chronic pain. And
Well, and not just pain, but chronic issues where it limits mobility, like shoulders. Um, we just get great results with it. We talk to them about supplements and lifestyle changes, but it literally takes less than 15 minutes, and I can work with anybody from their shoulders to their toes. And it's fabulous for erectile dysfunction. Usually about 3rd to 5 visits, you get results the very first visit, and it builds. You get the best results usually between visit 3 and 5. But we are super excited about that. There's no medications involved. It is uncomfortable. It should not be painful, but it's not like a massage or anything. This is not your like your little massage gun. That's very superficial. This goes really deep and resonates through the joints and things. But I love the machine. I've got fabulous results. I love to see people get up off of the table and stand straight up and walk out of the office in a whole lot less pain than they did when they walked in. I'm really weird about how I do it and what I use. So if you research it, they're going to tell you that you're going to use ultrasound gel. I do not. I use castor oil. I use organic cold pressed castor oil. One, it's an anti-inflammatory oil. You can use it on any part of your body. You can eat it if it's organic. You can put it in your eyes, up your nose, or whatever. It doesn't have air bubbles, so the machine doesn't have to break down the air before it gets to working. And it's just a much cleaner, no chemicals lubricant. So that's what I use. I love the machine. If you're local, come see me. I can help. Um,
This is the only machine in the area. Oh, hi,
yeah.
Zoe.
Yep, you can find this northern Indiana, big cities, Louisville, Carmel, and things like that. But we have it, and if you're local, call us.
Go onto our website or you can go onto our YouTube channel and you can look at our testimonials. I know they're getting loaded. We just had fresh testimonials done, and so they are getting loaded onto YouTube. And I think at least one of the patients talks about Shockwave.
I think he talks about Shockwave in length. So in that particular gentleman, we've done his elbows, shoulders, lower back,
Power lifter.
sciatica, knees, and feet. And he has been a college athlete, high school athlete, wrestling, football. He has done great things for himself with diet, and he is he's able to lift heavier, warm up shorter, and do his workouts, the meat of his workout longer. So we are super excited for the Shockwave, and I am personally super excited for the people that we have been able to help and care for, and to watch them come back in and be like, this is the best I felt in years. So if you are local, come see us. If you're not local, check out Shockwave at some place in your area.
And that's just another way that Integrated Health of Indiana is serving you. And that's how our tagline is: we help you heal from the inside out. And that's what we're doing. Now we're doing functional medicine, chiropractic, acupuncture, shockwave. We hope to bring the IVs back soon.
Yep, we got ultrasound therapy, but if you're interested in Shockwave, look it up. There are some things that Libby, that
Say-
if you have or are taking, so there's some contraindications, of course, but if you are interested, give us a call, send us an email, and we'll
He's
ask
biting
you
the
questions
dog.
and get you scheduled.
With that being said, glad you're listening, Zoe. Hi, everybody. You have a great evening, and we'll see you next time.